Good day, sir. I am Aira Lopez of BSN 13, and today I will be performing the return demonstration for the procedure of administering sublingual medication. The purpose is to provide a medication that has a systemic effect or local effect on the sublingual route. For the assessment, we must assess for the following such as the client's level of consciousness and ability to understand instructions, the client's vital sign, if the patient has nausea or vomiting, and also for recent diagnostic or surgical procedure, the history of allergic reaction to certain medication, also for if the medication has an unpleasant odor, the expiration date of the medication, the color and appearance of the medication, as well as the intactness of the wrapper. So for the planning, we must observe the 12 rights on giving medication such as the right patient, right drug, right dose, right route, right time, right documentation, right assessment, right evaluation, right drug presentation, right motivation and approach, right to refuse, and the right of the client to know the reason of the drug to be administered. And then we have to perform hand washing before and after the preparation. For the materials, we have to prepare the following such as the hypotray with lining, the prescribed medication, the medication card, and the medication cup or glass. So moving on now with the implementation or the procedure. So first, we have to perform hand hygiene and put on PPE if indicated. And then we have to identify our client, introduce ourselves, and explain to the client or relative the procedure as well as the action of the drug. So doing this process will ensure that we are giving the right medication to the right client. And then after that, so ma'am, good day po. Ano pong pangalan niyo at birthday?
Leana Lopez, September 27.
Okay po ma'am, thank you. So ma'am, ako po si Aira Lopez. Ako po yung magbibigay po ng gamot nyo ngayon. So sublingually po or ilalagay po natin sa ilalim ng dila po ninyo. Okay po ma'am? Thank you po. So after that, place the hypotray onto the bedside table and provide the client safety, privacy, and comfort. So we have important reminders upon providing those such as proper positioning based on the procedure. It can be sitting, supine, or a side-lying position. Also by pulling down the side rail on the side that we will work on while keeping the other side rail up. Also spreading the curtain or closing the door before and during and after the procedure. And also by placing the call light within the client's reach. So now, put down the side rail on the side that we will work on and assist the client into a sitting and not possible a side-lying position to avoid aspiration. So ma'am, okay na po ba kayo sa pwesto po ninyo?
Okay.
Okay po ma'am, thank you. So first, we must put on clean gloves. And then, unwrap the medication and ask the client to open her mouth, lift her tongue, then place the medication under the client's tongue. So ma'am, bukas lang po ang bibig, taas po ang dila. Sara na po. So after that, hold it in place and have the head of the client tilt forward to avoid swallowing. So ma'am, ganun lang po tayo konti. Thank you po ma'am. So, holding it in place to ensure that the medication will be dissolved completely and be absorbed for at least 10 minutes. And then after that, we will assist our client into a comfortable position with raised side rails. And then, now, ma'am, ayos lang po natin yung position nyo. Okay na po ba?
Okay.
Then after that, dispose all used materials properly and rearrange the reusable ones. And then remove PPE or gloves if used, and perform hand hygiene. So after that, we will now assess for the effectiveness of the medication given and document the administration of the medication into the client's chart immediately, including the client's reaction to the medication after administration. And lastly, evaluate for the client's response to medication within appropriate time frame.